Eagle Radio welcomes you to Health Information Please, a program of wellness news and your chance to ask questions. Here's your host, Mike Cooper.
And making a return visit with us after far too long being away, and being very patient, too, while we're going through all the bulletin board items, we might add. Welcome back to Sue Noll.
Thank you.
Sue, I want you to come in real close to that microphone. That's one thing I forgot to tell you.
All right.
So that everybody can hear what you have to say, because it's vitally important to the overall care that's provided at HaysMed. First of all, Sue Noll, RN-BC.
Mm-hmm.
What's BC?
BC is a certification in pain management. It's just kind of a separate thing. And then the other initials are a certification in hospice and palliative care.
Ah, that's the CHPN part of it then.
Yeah.
Okay. She's got so many initials, they don't have room for her on the support page at HaysMed, so they just put Sue Noll, RN, I think.
That works.
Hospice and palliative care, something that you've been involved in for a number of years, Sue.
Yes. I started in hospice 28 years ago. So.
How did you start? Did you start as a volunteer?
No, I had been a nurse at the hospital for 10 or 11 years, worked in all different areas. Mm-hmm. And at that time, I worked in the oncology unit, and in the oncology unit was the hospice office. So I got to know the hospice nurses and social workers in that office really well. And there came an opening, and a nurse was leaving, and so I applied for the job because it really, I watched what they did, and I was just so impressed with their holistic care of patients, and a lot of the patients I knew because I took care of them on the cancer unit. So it was just a wonderful transition. I knew a little bit about it. I thought that I had enough nursing experience that I had a lot to bring to them, and what I found out was that wasn't true at all. I became a student, and I have learned over 20 years or 28 years. I've been a student, and I've learned so much from the patients and families that we've taken care of. So it's kind of turned around. They've taught me. So,
but at the same time, Sue, nursing and the palliative care and hospice care kind of blends together. They complement each other, don't they?
Yes. The type of care that hospice provides is called palliative care. And palliative, the root word of that means to cloak or to cover. And so the whole idea of palliative care is that it comforts and supports someone when they have a life-threatening or terminal illness. Hospice confines it to a program that is the last 6 months of someone's life, where the whole idea of palliative care is a philosophy of care. And what's happened over several years now is they've been saying, why do people have to wait until the last 6 months of life to get all this palliative care, which is very holistic, addresses the spiritual, physical, psychosocial needs of the patient and the family. Why only then? Cannot we move it upstream to when someone is first diagnosed with a life-threatening illness like congestive heart failure or a pulmonary disease or ALS or cancer? Maybe they're going to live years, but it is a life-threatening disease, a serious illness, and so can we take what hospice does and move it upstream to that and start that kind of care and attention earlier? And what they've found out with studies they've done that have palliative care teams involved, and the studies they've done have been particularly with cancer patients, that they will live longer, have less pain and other symptoms, and have better outcomes. So they found it's a good thing, but trying to figure out how to do it, because hospice is paid for. There's set payments coming from Medicare, Medicaid insurance for hospice. It's a federal program with regulations and rules, where palliative care is more a philosophy, so it's not really defined, as far as paying for it. So a lot of hospitals have palliative care teams like ours. They do it not for any financial benefit, but because it's the right thing to do and because it helps people and people have better outcomes. So,
how long has this program been in place at HaysMed, then, the kind of cooperative combining, Sue?
The palliative care.
Mm-hmm.
The palliative care program's really been around a long time. I've been doing palliative care consults there as a nurse probably for about 10 or 15 years, where they recognize that hospice has a certain set of, they're educated in how to communicate with families, how to talk about a serious illness. They're educated in pain and symptom management, in grief issues. So the staff in hospice, they know this and they know how to do this. So I think the healthcare people have recognized that, to call a hospice nurse in to sit down and have this family conference, or a hospice physician or a hospice social worker, they know how to conduct these meetings and how to talk to people about these things. So, yeah, it's been around a long time, sort of informally.
The palliative care, though, as you mentioned, really covers not only the individual, but the family and associated. It is a blanket, isn't it?
Right. And that's the key. It's never, in hospice or in palliative care outside of hospice, the focus is the patient and the family. Well, the family is for whom it matters. So the family can be not blood relatives, but whoever's involved in their care, for whom that patient really matters to them. And so we look at how do we best support them through this process. So the palliative care consults that we get at HaysMed, and we do have a separate team from hospice for that. I'm involved in both. Our hospice social worker is involved in both, and the chaplain at the hospital is involved in both. But other than that, there are other people on the team. We get referrals, and maybe someone has come in and they have congestive heart failure and they're getting worse, and maybe there needs to be a family discussion, about where do we go from here? Do you have the support you have? Are your symptoms controlled? There may be someone in the hospital who the patient isn't able to eat and drink anymore, and they're looking at, do we put a feeding tube in or not? What do we do at this point? And they need someone to talk to. So the palliative care team does not tell anybody what to do, but they come in and have these discussions and try to determine, first of all, what the patient wants. Do they understand all the options? And based on that, what do they want to do? And if they can't speak for themselves, what does their representative want to do at this point? And then to respect their wishes. So that's what we do. And the palliative care team works with the physician, whoever the physician involved, whoever the respiratory therapist, all of them, we work together. And the new guidelines for palliative care that just came out, they're recommending more that not you have certified professionals doing palliative care consults, but that you teach everyone to do it. So there's a real push to try to educate doctors, nurses, and social workers and chaplains. How do we do this? How do we all do it? How do we all see a patient as a holistic person addressing all these needs? There needs to be education in all those areas. So what KU's been doing, and I'm part of that too, is they're going around to rural hospitals and areas and holding workshops to educate the staff there. How do you do palliative care? How do you do a consult? How do you talk to people about these serious and important issues that come up? And how do you listen? That's the most important thing. And determine, what they understand and what they want, and support them through the whole process.
That's another great link with the University of Kansas healthcare system, isn't it?
Yes, it's a good thing. So.
All right, let's talk about some specifics this morning with our guest, Sue Noll, registered nurse, and we're talking about hospice and palliative care, and we can open phone lines, and Sue would love to talk with you about these programs at HaysMed. Although they're separate, they are kind of under the same umbrella, if you will. But if you have questions, call 625-1114 or 785-625-1114. If you're outside the area, you'll be talking with registered nurse Sue Noll, back with us to visit about hospice and palliative care. And we told Sue she'd been away far too long. We want to see more of her with this very, very important program that's a part of the overall care at HaysMed. 625-1114 or 785-625-1114. And besides that, the host thinks she's just a delightful lady, and it's fun to visit with her on a regular basis. So it's nice to have her come in and talk about this very important program. Before we get too far, I want you to talk about the community memory tree so we can promote that event, would you?
Yes, this is our annual hospice fundraiser, the community memory tree. And what it is, you donate a certain amount, and the hospice people will engrave a brass dove. Should have brought one of those. I just thought of that. And with the name of your loved one, whoever you are honoring and remembering, and then that hangs on our hospice trees during the Christmas season. So the trees are going to be put up next week. There's 2 trees in front of our hospice office by the gift shop at the hospital. There's also a tree in Plainville at the Des Fournier building. And so if you would like to do that, you can call our hospice office at 623-6200, and we will make sure you get the form to fill out. And the reason you fill out a form, we want to be sure we get the spelling correct of the patient, because those doves are engraved by an engraver, one of our volunteers. So we want to make sure we have the spelling correct of that person. And those doves will hang on those trees throughout Christmas. And after Christmas, some people want their dove, and so they can come and get those doves, or we'll mail them to them. Other people leave them with us, and, the following year, if they notify us, we'll put them up again. But that's our one fundraiser we do every year, is the community memory tree. So.
Okay, so how do we get one of the forms then?
The forms you can get at the hospital. They have them in different areas around town, I think. But basically, if you call our office, we can email you a form. If you go to the Hays Medical Center website, the form is on there.
I was wondering if maybe they could just download
one
from the website. They can download it.
Yeah, good. Absolutely. Okay. Fill it out and then get it to us. We do need to, with the donation, that's why people come by the office or mail them in, because of the money that comes with it. But certainly at the hospital, anywhere you can stop in and get a form.
And again, the donation, how much donation
is it? They recommend $20, but it's really whatever you can afford or whatever you want to give. There's really no set amount. That was just a suggestion. So it's kind of whatever you feel you want to donate to hospice is very much appreciated.
And the trees go up when?
The trees at outside of our office at HaysMed will go up next week, and then in Plainville sometime next week.
Okay, yeah. And what's the cutoff date for people sending in the applications? Because your engraver is going to have time to get those doves engraved.
Yeah, and they take them down like the week after, or a few days after Christmas. I guess Christmas is on a Tuesday this time. So they'll be taking them down sometime during that week, right after Christmas. So, yeah, if you can get it in at least a week before Christmas, so we have time also to hang the dove up and let it be there for a while. If you the day before Christmas, that would be kind of late. So as soon as possible.
Can you specify which tree, like at the one at HaysMed, for example, or the one if you're closer to the Plainville area, Stockton and so forth?
If you're in Rooks County, you may want to use that at the Des Fournier building, and I think they have the flyers over there too. If you're, we serve 4 counties. We have not only Rooks County and Ellis County, we have Rush County and Russell County. We haven't had anyone offer to put trees up in those 2 counties, so those 3 counties would all be on the Hays tree.
Okay.
And they divide them in alphabetical order, so it makes it easier to find your dove when you come up there. Some people, and it's going to be right in front of our office this time, which is really nice, because you can knock on our door if you can't find your dove, and we will help you find your dove. So.
All right. So if you're in the Russell area and you have a business, if you have a display area, maybe a lobby of a bank or one of the businesses in downtown Russell, you could reserve a little space for the hospice tree for those in the Russell community, and help us out here on because the program is available on Eagle Television in Russell, and of course through KAYS and KVGB as well. So one of those businesses in the Russell area to sign on for this would be great, to have that tree displayed in the Russell area. Right. And same if there's somebody in the Rush Center area that might be able to do that for those that listen to the Great Bend KVGB location. So, yeah, the volunteers for a $20 donation if possible, or whatever you could afford. And the forms are available online at the HaysMed website. Mm-hmm. Or you can stop by HaysMed, pick one up there. Now, your offices, hospice offices, are located in the main complex, right? Yeah, we are now in the hospital. We're not off campus anymore. And if you come into the doors of the gift shop, where the gift shop is, on the west side of the building, our hospice office is right before you get to the gift shop. Okay, all right. Yeah, if you ever want to stop by, just knock on the door, ring the doorbell. And that's not a bad place to visit either. The HaysMed gift shop has a lot of unique and wonderful items there. Okay, we're talking about hospice and palliative care with Sue Noll, registered nurse at HaysMed. 625-1114 is the number to call. If you're outside the area, just put the area code ahead of that number, 785-625-1114. Let's focus for a moment back to hospice on volunteers. Volunteers really are an integral and important part of hospice, aren't they, Sue? When they set up the hospice Medicare benefit in the 80s, signed it into law, that part of that was that hospice has to have volunteers. And they're so important that 5% of the time that our staff spends on patient care, we have to prove that we're spending that amount on volunteer time with our patients too. So that's how critical they are to hospice. You can't be a hospice and not have volunteers. So, but they do everything for us. We have probably about 60 volunteers in the 4 counties we serve. Some of them do office work for us. Some of them will sit with patients in their homes so the family can get away for a little bit. Now, these are not nurses or anything. These are like your neighbor coming over. Companions, if you will, for a short time. Yeah, for a short time. Some of them will run errands. We have teams of volunteers for our patients in nursing homes that will visit those patients. They can read to them, or and that gives the families a lot of comfort, especially if the family can't be there all the time. They appreciate the fact that volunteers are checking in. They help with everything that we are involved in. We have a memorial service in town. We rotate churches, and we do that every 6 months. The volunteers are integral in that. They bring treats, they greet people, they do everything. We have every one of our hospice patients gets a homemade, handmade quilt and with a prayer on it. Those are made for us by volunteers. Every one of our, when there's a death, we take a candle to the funeral home, and those candles are decorated by our hospice volunteers also. They help with fundraising. They help with, there's a hospice volunteer that does this dove engraving. They hang the doves on the trees. They do everything. Even in our bereavement program, they will call people, check up on people that are in bereavement care to see how they're doing and that kind of thing. So really everything we do, the volunteers are part of. And it isn't necessarily that you have to interact with an individual if you're uncomfortable in that particular setting, although training, of course, will certainly be a part of that. But if you're interested in so many other areas, a lot of different areas of opportunity for helping hospice. Right. There are, and that's we have, when we have several people interested, we'll have a volunteer training. It's a one-day training. We go through a lot of just the basics of hospice. We talk some about pain and symptom management. Our social worker will talk about the psychosocial issues of the
family that they're going through. We talk about spiritual care, and so they get a holistic view of what the hospice is, and then after that they can say, well, I'd like to work in this area or that area. They don't have to do anything, they can think about it, or some go through the training and go, well, that was very interesting, but I don't have time right now, and that's fine. So, and then our volunteer coordinator will assign people based on what they want to do and what time they have to do.
So you can pursue your own interest with the hospice program and yet be a part of something that could be life-changing in some ways.
A lot of our volunteers have been volunteers for a long, long time, and they say it's very rewarding. A lot of our volunteers are part of families that we have taken care of one of their loved ones, and then later on they want to be a volunteer. So it's a really special group of people.
Without naming names, who's your longest-serving volunteer year-wise?
Year-wise, let's see, because I started 28 years ago. I know we have somebody there that's probably been there 35 or longer years. Yes.
How about that? Even superseding you.
Oh, yes.
Oh, my.
Absolutely.
That's amazing.
Yeah, absolutely.
So it is a calling, I think, to an extent, isn't it, Sue?
They say it's very rewarding. And I think that, we get so much back by helping people. Everybody knows that. And so this is a way to help. And they're just a wonderful group of people.
Talk about your other co-workers, if you will, as far as the spiritual aspect, the social aspect. You have, Myrna, for example, been there for about as long as you have, or maybe a little longer, possibly.
Yeah, she's been there a long time. Yeah.
Talk about all of the implementation of how all this comes together.
Okay. When we admit someone to hospice, we address not only their physical needs. We talk about pain and symptom management that we want to take care of right away. Do they need any medical equipment? Hospice pays for any medical equipment they need. If they need a hospital bed, oxygen, wheelchair, commode, hospice pays for those things. If it is a situation where they have a tracheostomy and they need supplies, we pay for those things. If they have wound care, those kind of things, hospice will provide and pay for those things for people. So that's the physical part of it. We also do a spiritual assessment at that time, and we want to know, is religion or God important to you? Do you have someone in your life that provides spiritual support to you? Is it okay if we contact that person and they become part of our team? We invite them to our team meetings. They actually document their visits and send them in. They're part of the chart. So we want to know, do they have any spiritual issues that we can help them with? And then if they don't have a person in their life like that and they would like to talk to someone, the pastor at the hospital, Karen Harvester, is our hospital chaplain. She's also our hospice chaplain. And so she will go and visit with people if they want to talk to her. So she's available for that. And she attends all our meetings, our team meetings, and so kind of oversees the spiritual aspect. Also helps us with communication oftentimes. If someone has come to town and they don't have a church home or a pastor, but they're of a certain religion, we might contact Karen because she has contacts with all of them. She's also the head of the Ministerial Alliance right now. And so she can maybe facilitate that for us and find a pastor or priest who could visit this person. So the spiritual care follows them all the way through, and what needs do they have, and how can we best address it? And it's it's whoever on the team that we need to pull in. And Myrna is our hospice social worker. Has been there a long time, longer than me, I think. But she addresses the psychosocial aspects. So what Myrna does is she wants to know what other issues this patient and family are dealing with, as well as the terminal illness and facing death. What else is going on in their lives? What financial concerns are they facing? What community resources do they need that we can help facilitate, and how are they coping and how have they coped in the past, and how can we support that coping mechanism. So Myrna's role is sort of as counselor, and she visits all of our patients and families. She talks to people on the phone. Sometimes if there's a grief issue, particularly we take care of patients in facilities like nursing homes and that. Sometimes the administration will have her come out and talk to the staff if there's been a lot of loss. She's available for that too. We have a lot of literature in our office for grief and bereavement, how to support people. We have coloring books for children. We have all kinds of things like that. And one thing neat that Myrna has been instrumental in our community in the last few years is the Healing Kids' Hearts camp that she has helped with. It started with the Center for Life Experiences here in town, but Hospice helps with that in the way that Myrna does a lot of the training and stuff and talks to the parents and trains the volunteers. And a lot of our hospice volunteers and our staff help volunteer their time to help with this kids camp. So it's a wonderful thing. And then Myrna also does I wonder if she's listening. She says, she's saying my name over and over again. But she, as our social worker, leads up our bereavement program. And at any given time, we have about 200 families that we're following in bereavement care. And they get support for at least a year after the death. And so she does assess. Go ahead. You're going to ask.
Well, that's amazing. I think that it doesn't end with the loss of a loved one.
Right.
It continues.
Right.
Go ahead.
It continues. So that, that part of it is the nurses that were real involved with this patient will do follow-up phone calls with the family. And then our social worker will do an assessment to see what their grief and bereavement issues are. And then there's literature that goes out at certain times to the patient and the family. And then if they need referrals or they need to talk to somebody privately, that is offered. Our volunteers do a lot of that, too. They check on people.
Such an important part of the overall care at HaysMed, hospice and the palliative care that takes place, because it's a central part of our lives, Sue.
It is. And I think people have a fear of hospice because they think, oh, wow, that really means that I'm going to die. And so it's a scary thing, but the feedback we get from our families is very good because they get all this help when they really need it. The nurses are on 24-hour call, so at 3 a.m. on a Sunday morning when, you need help or the patient's in pain or you have a question, you can get a hold of the nurse on call. And so that support they get, with the volunteers and everything, they're very appreciative of that. We do dismiss patients that get better, though. A lot of people don't realize that. If you come on to hospice and the two physicians, which is our medical director and your own doctor, have said, well, with our best guess, we think that they probably have 6 months or less to live, which is the requirement for hospice. It's always a guess. And so with the Medicare regulations, we have to continue to show some decline or something, but sometimes for whatever reason, because it's out of our hands, people start to get better. Yeah. And we have dismissed people from hospice, and they can come back on later, but that does happen.
Sue Noll is the registered nurse who is overseeing the hospice and palliative care program at HaysMed. And if you have questions about any of the areas Sue has talked about, call now at 625-1114. Or if you're outside the area, call 785-625-1114. This is Health Information, Please, on KAYS, KVGB, Eagle Community Television, HaysPost.com, and the iTunes and Google Play apps at 94.3 KAYS. You can also listen to the program on your computer or tablet on HaysPost.com. You brought another flyer along with you, too, that I wanted you to specifically talk about, Sue.
Okay. This is our flyer for hospice. It's our hospice brochure. It says a special kind of caring. And it has some quotes from families on the back that we get a lot of cards and letters and different things from families with telling us how much they, appreciated our help and things like that, which is some of the blessing of hospice. And so a lot of times people just want information, and anybody can call our office anytime. Sometimes people will call and say, well, I don't need hospice now, but I might sometime. Can you just drop some information? We'll send you this brochure with some other information about hospice. In hospitals and nursing homes, sometimes they will put someone on comfort care, which means that it looks like things are declining. The family's decided they don't want to keep doing aggressive care anymore, and they probably don't have too long to live, and they'll put them on comfort care. Some people think that they're on hospice, but you're not on hospice until you actually meet with a hospice team and sign the consent forms for hospice. So that's one of the...
That's the starting point.
That's the starting point. It's not an automatic flip into hospice. You have to agree to it, and you have to want it, and then, meet the Medicare guidelines and everything. But we do take care of all ages and all illnesses. Sometimes, like I said, people come on hospice and they get better. Sometimes we get very late referrals, and that's something we deal with in hospice, is that most of our patients are on less than 3 weeks, so very short periods of time. But it doesn't matter to us as far as if they're on 1 day, we still follow that family in bereavement care for a year, so you still get that benefit of that.
You basically want to help people no matter what the termination factor might be as far as time goes.
Right, as far as time.
This brochure that's available at the hospice offices
Yes.
Is that generated in-house then? Those comments and things are from people who've actually experienced the hospice care?
Yeah.
Oh, great.
From hospice care. So.
That's available. And the hospice office, again, is located where, Sue?
It is at Hayes Medical Center, and it's just if you come in the west door where the gift shop is and look to your right, you'll see our door. It says hospice. And then starting next week, right in front of there, you'll see our memory trees with the beautiful doves on them and everything. But if you have questions about hospice, about grief and bereavement, or you need help and support, we are here for the community. So definitely call our office, and we'll try to help you as best we can. We're good at working with a lot of different community organizations to be able to direct people in those areas.
One of the keys, I think, that you mentioned, Sue, is the resources available, which the hospice volunteers and your office knows about in the community and in those counties you serve, the 4 counties in the area. Right. They know about them. The average individual may not know about the resources that are available, and this is where the program is such a help.
It is. A lot of people, you're not aware till you need something, basically. And a lot of people are not aware of what all hospice does to help, because we pay for medicines that are for comfort care. If you're on pain medicine or bowel medicine, nausea, if you need breathing treatments, all of those things are covered by the hospice, as well as your equipment and supplies and visits by the team. So a lot of people just don't realize what all we do, and they don't realize that it's a Medicare Part A benefit. If you have Medicare Part A, you have a hospice benefit. If you have Medicaid, you have a hospice benefit, and most insurances cover hospice. If you do not have insurance, we will still admit you, and we will still take care of you, and we will still provide all those things that you need, because we are a non-for-profit. And people are always surprised when they find out what all hospice can do for them.
Yeah, it's an amazing program, to be sure. And there is literature available for your own use, and you can look it over at your own leisure through the hospice office at HaysMed. Sue Noll is our guest today. She is a hospice director, registered nurse at the HaysMed facility. And if you have a question, we still have time for a call or two. 625-1114 is the number to call. This is an information program. You don't have to give your name, but if you'd like to talk with Sue and ask a specific question, call now. Lines are open. We have time for a call or two at 785-625-1114. This is Health Information Please on KAYS, KVGB, Eagle Community Television, HaysPost.com, and the iTunes or Google Play apps at 94.3 KAYS. Want to make sure that we've got everything in, and we're going to revisit the dove and the memory tree before we close our program. But is there an area of hospice or the palliative care that we haven't emphasized that you'd like to re-emphasize, Sue?
Yeah, I'd like to say there's some confusion about the palliative care program. It's not a home program like hospice. At Hays Medical Center, it's a consultation program. So it's basically the consultation with somebody on the team about your serious medical illness and those kind of things. But hospice is the program where they visit you in the home or nursing home or assisted living, and they pay for things that you need, and they're on 24-hour call. The palliative care here is more like that. It is available for consultations for people in the community. I have had doctors call me to go out and visit with someone at a nursing home or in a home because they're dealing with a lot of issues around their illness, and see if there's any ways that, the team can help them. But it's not what hospice is. I think it may be someday because they may set up actual regulations and payment for it, and it may look like that. But right now it doesn't. That's what it is here in town. So anybody can ask for a palliative care consultation if you have a serious or life-threatening illness. You just need someone to talk to, or you can ask to talk to someone from hospice if you just want information about that program.
And there are a lot of people that can help, yourself, Myrna, Karen, the spiritual director at HaysMed, Karen Harvester, a lot of people you can talk to find out more information, get the information you need. But as far as hospice goes, once again, it is available to those who are in hospital, who are at home, who are in assisted living or nursing homes, right? Yeah. It's available basically wherever the person is.
Wherever the person is, yeah. If they're in the hospital, they can't be billing Medicare for that room at the same time and have hospice. So that's usually what the hospitals will do is they've run out of where Medicare or their insurance won't cover them to be anymore, but they're dying at the hospital. And so the family doesn't want to take them anywhere else, or they don't have anywhere to take them. And the hospitals will sometimes allow people to privately pay to keep them there, and we can admit those people to hospice in the hospital, but only if they're not billing their insurance for that hospital room. So some hospitals will make exceptions to those things, but basically about half our people are in nursing homes and half are in homes. Basically is how it works. Yeah.
We have time to revisit the community memory tree once again. Yep. Listen closely for the details on this if there's a loved one that you'd like to honor. Sue?
Yeah, if you would like to honor a loved one, it doesn't matter that they were in hospice or not. We're not concerned with that. It's anybody that you want to honor. You can contact the hospice office or go to the HaysMed website and go to the hospice section, and this form is downloadable. You can write there who you are and, of course, who you want to honor. Make sure the spelling is clear so the engraver can make out all the letters and that kind of thing. And then you just send this in with your donation or drop it by our office, and then we will get the dove engraved, and it will be on the tree. So.
And the ask for donation is $20, but anything less is okay.
Yeah, anything that you can give is appreciated.
And the trees will be located again where, Sue?
In Plainville, for Rooks County, it's the Des Fournier building on Mill Street. And in Hays, it's next to the gift shop. Just west of the gift shop, you'll see there's a seating area there. There's going to be 2 trees there. They are going to be separated in alphabetical order. Somehow you'll be able to at least get the section where the name will be. So The volunteers they'll start putting those up this coming week. So.
And if you need help finding that particular dove, the volunteers will once again be able to help you find it.
Or anybody in our office, our office is right there. So.
And once again, Rush Center and Russell, we need your help with a location for a tree.
If Russell or Rush County, Plainville just years ago offered this to us, they put up a tree over there. So if any of the other areas want to put up a tree and have the doves from their community on that tree, that's perfectly fine. So we have volunteers in all the counties.
Oh, great. And a really good way to honor a loved one.
Yeah.
What a great program.
Thank you.
What a wonderful, wonderful job you're doing, too. As I told Sue earlier, how many lives have been touched and helped by your volunteers, your efforts, Myrna, Karen Harvester, the people that work through the hospice program, through the palliative care program at HaysMed. And, of course, that includes the doctors, all of the nurses who are so involved with the patient care as well.
Yeah.
Makes a world of difference.
It is.
You people are doing.
We're very blessed. The nurses and our team for hospice, wonderful people, been around a long time. They're kind of like me. You get into it and you find out it's just very, very rewarding. We work well with all the doctors. We have good relationships with all of them in the nursing homes, and it's just a very rewarding. It's not like work. I love going in every day. So
first thing you need to do is to call